Pharmacodynamics. What is pharmacodynamics? Anyone? Statistic of drugs. The effect of drugs on body in the form of biological changes. When we administer a drug, it do some conformational changes to the receptors or other macromolecules and produce some biological changes. So pharmacodynamics is the effect of drugs on body. For example, pharmacodynamics. Pharmacodynamics is the effect of drugs on body. How drugs produce effects or it can respond to the body. It will be or it must be attached with macromolecule and produce some direct signals, or it will produce some second messengers, right? We will discuss all these primary and secondary messengers and the effect of these messengers on cell. So the drugs must be attached to macromolecules and will produce some biological changes in cell. This is called pharmacodynamics. These changes maybe they are beneficial or maybe they are toxic. The effects of drugs, for example, drugs effects. Drugs effects may be beneficial or it may be wanted effects, or it may be unwanted effects. What are the wanted effects? Wanted effects are basically these are the indications of drug for the reason why we are taking drugs. For example, if a patient have headache and he or she is using acetaminophen or Panadol, and due to the use of this Panadol, this headache is finished. This is the indication or this is the wanted effect. What we want. This is the analgesic effect of drug. This wanted effect also known as beneficial effect. Every drug have wanted and unwanted effects. Every drug, right? And these unwanted effects are basically they are ADRs. Adverse effects are they are also known as side effects. For example, acetaminophen, the indication of this acetaminophen is it is analgesic drug, or also it is antipyretic drugs. It lower down the temperature of body. Also it acts as analgesic because Panadol directly attack on CNS system, right? What will be the unwanted effect? Hepatic failure or nausea, dizziness, vomiting. These are the unwanted effects that must occur with the wanted effects of the drug. So the drug response in pharmacodynamics, we are talking about the responses of drugs on body to body. These responses may be wanted or it may be unwanted, right? And every drug have wanted and unwanted effects, right? For example, anti-cancer drugs. Cyclophosphamide. Cyclophosphamide is anti-cancer drug, and beneficial effect or the wanted effect of this drug is to finish the cancer or to stop the mitosis in body. But the unwanted effect is very severe. It accumulates in the transitional epithelium of the urinary bladder and it can cause cystitis, right? So these are the unwanted effects. How the drugs produce these wanted and unwanted effect? The drug needs some macromolecules for showing its effects or responses. And what are these macromolecules? They are basically called receptor, right? What is receptor? Receptor is one of the main thing in cell signaling. It taking the signals from extracellular environment, from outer environment, or from plasma, from blood, right? Or the nucleus is taking signals from cytosol. All the functions or all the signals is transmitted to the cell through receptor. So here in pharmacology, we can say that drug is acting as signal, right? And receptor is acting as signal transducers or transmitter. For example, if we have a cell here, for example, this is cell and this is nucleus. For example, here is a receptor. Here is a receptor, and the drug or any type of ligand occurs and attached to this receptor. This receptor will bring some biological changes inside the cell, right? So we can say that this drug is acting like a signal and this receptor is acting as a signal transmitter to the cell, right? So now we will discuss the receptors. Receptors are very important molecules in the cell, which is basically important in nervous system, in endocrine system, in biochemistry and physiology, also in pharmacology. But today we will only discuss the receptors which are important for biochemistry, physiology, and especially it is important in pharmacology, because our body have a lot of sensory receptors like taste buds. Taste bud is a receptor, like thermoreceptors, right? But we are not talking about the thermoreceptors or the mechanical receptor or the taste buds, sensory receptors. We will only focus on the receptors which are acting on drugs or hormones or neurotransmitters, are important in biochemistry, physiology, and especially in pharmacology, right? So what is receptor? Anyone? What is receptor?
They are the one big cells on the surface of the cell which
Hmm?
recognize the drug or the signaling and indicate the response.
Indicate the response. Anyone else? Mehran, what is receptor? Are all the receptors will be proteins? Why? Very good. Not every drug can respond to a protein. They can directly act on DNA. They can directly act on albumin proteins, but albumin is not a receptor and DNA act as a receptor. So there are 2 points which are very important about receptors. They are, the receptors are any macromolecule. They may be protein, may be lipid, may be glucose, or may be DNA nucleic acids or RNA, which have at least which have 2 domains. One is for drug binding or ligand binding site, and one is effector. On one side the drug will bind and on other side it will show some responses, right? But the receptor have many types, and we will discuss today basically 4 types. Every student know the 3 types of receptors: surface receptor, cytosolic or intracellular receptor, and intranuclear receptor. One another type is, anyone? Are in gustatory and optic ends. Ligand binding receptor is a type of surface receptor. One another question: why some receptors are present on surface of cell, why some are present in cytosol, and why some are present in nucleus? We discussed this topic in detail in pharmacokinetics, that some of the drugs can cross the cell membrane. Some of the drugs can pass cell membrane. So the receptors are present in cytosol. Some of the receptors cannot pass through cell membrane, so they will bind to the surface receptor. And some are very lipophilic, they can cross the nuclear membrane also. and will act in nucleus. So, for example, first of all, what is receptor? Receptor is any type of macromolecule, especially they are proteins, which have at least two domains. One is ligand binded domain and the other is effector domain, to which a ligand binds and shows some biological reactions inside the cell. So for example, I am taking a cell again here. For example, this is a cell, right? And this cell have right. For example, here is a macromolecule. This is a macromolecule, and here it also have some domain. So make receptor is a macromolecule. You can write it macromolecules which have at least two domains. One is ligand binding domain, and the other is effector domain. By effector domain it will show responses, and by ligand binding domain it will attach something to itself, right? So for example, this is a drug. Here this is a drug, or this is a ligand. Ligand may be neurotransmitter, it may be hormone, it may be toxic things, it may be any chemical substance, or it may be drug, because we are studying pharmacology, so we will focus on drugs, right? So for example, this is a drug attached to this receptor. So the site by which the drug is attached to receptor, it is called ligand binding domain, right? And for example, here it shows some response. What is the response? For example, it is activated, and when it activated, it raises its hands, or it this is the tongue of receptor. For example, this is the domain, drug binding domain, and drug occur and binds here, and the receptor, this is the response, right? So the receptor must have two domains. One is ligand binding domain and the other is effector domain. So macromolecules which have at least two domains, effector and ligand binding, and to which a ligand binds, and by some conformational changes, it shows biological responses. What are the example of biological responses? For example, glycolysis, Krebs cycle, protein synthesis, right? Contraction, relaxation, neurotransmitter release. These all are biological reactions or biological responses, right? So receptors are any type of macromolecules. It may be protein, but mostly they are proteins, because about 50% of the drugs acts on serpentine receptors, 7-pass receptors, right? We will discuss this. It must have this is the main point, because if we take albumins in plasma, I have discussed a topic, plasma protein binding. The drug, when absorbed to blood, it will attach to albumin, right? Is this albumin is receptor? The answer is no. Why? Because it have only the binding site, it have not the effector site. It cannot show responses. So it is not act as a receptor, right? And receptor must have effector domain, right? So the receptors are macromolecules which have at least two domains. One is ligand binding domain. What are ligands? What are ligands? Any chemical substance or anything which can attach to receptor and show some biological responses is called ligand. This ligand may be neurotransmitters, like for example serotonin, acetylcholine, dopamine, epinephrine, norepinephrine, right? They may be hormones, FSH, TSH, estrogen, oxytocin, progesterone, testosterone, right? They may be drugs, antibiotics, antifungal, antihypertensive, anti-cancer, etc. Right? They may be toxic substances, any toxic substance. Right? These ligands may be allergen. They may be allergens which cause allergy, right? Hypersensitivity. And the ligands may be dust from outside, right? So these are the ligands. When for example this is again a cell and this is a receptor. For example, it have a ligand binding site and it have also the effector site. When the ligand any of the following things, neurotransmitters or anything else, came here and binds to the ligand binding domain and shows some biological reactions, right? There are 2 points very important. If this ligand enhance the reactions or activating the reactions, this ligand will called agonist. It will called agonist. If this ligand attached to this receptor and blocks these biological or decrease these biological responses, this ligand will called antagonist. Right? What is an agonist and antagonist? If the ligand is initiating the responding or it enhancing the responsive biological responses, the ligand is agonist. And if it blocks or decrease the biological responses by binding to receptor, it is called antagonist. Like for example, if morphine is attached to kappa receptor, it will increase the biological responses. And if naloxone is attached to the same receptor, it will decrease the biological responses. So we can say that the naloxone is the antagonist of morphine and morphine is the antagonist of naloxone, right? For example, if we take codeine and morphine, they are agonist, right? So if we take morphine will enhance the reactions and codeine also enhance the reaction. They are both are agonist of each other, right? So this is the receptor generally, right? Now we will go for the types of receptor. What are the types of receptors? We will focus on the 4 types: the intracellular receptors, the surface receptors, the intranuclear receptors, and one other is most of the students didn't know about these receptors. They are called extracellular receptors. The receptors may be present in extracellular spaces, right? Your Lippincott book mentioned only 4 types or 3 types, but Lippincott didn't mention the extracellular receptor. Extracellular receptors are also present in body. I will give you examples. So from here we will start in receptors. This is only a concept about pharmacodynamics. Now, receptors. There are 2 states for receptors and they are called receptor states. One is active form, one is inactive form. Receptor may be active in active form or it may be in inactive form. So we can activate the receptor and we can inactivate the receptors by drugs or by other chemical substances, right? The basic families of receptors are four. Generally, the first one is surface receptors, right? The second is intracytosolic receptor. It may be called cytoplasmic receptors, right? We can say that intracellular receptors and intracellular receptors are divided into two receptors, cytosolic receptor and intranuclear receptors, right? The next is nuclear receptors, which are present in nucleus, and the fourth one is extracellular receptor. This one is very interesting, right? Extracellular receptors. Intra
Nuclear receptor.
uh,
Nuclear receptor.
and this is intranuclear receptor. The receptors which are present in nucleus. Intranuclear receptors which are present next to nuclear envelope, right, in nucleoplasm. These receptors are present in nucleoplasm. These are present in cytoplasm. They are also called cytoplasmic receptor. They are present on cell membrane, and these are present in extracellular spaces, right? So for example, I am taking a cell here. This is 1, 2, or this is A, B, C and D. 4 types. The first type is present in cell membrane, surface receptors. The second is in cytoplasm, and of course we have here nucleus, and the receptor present in nucleus are intranuclear receptor. And for example, these are extracellular spaces, and here also the receptors are present. Which type of receptors are present here? We will discuss this in detail, also the mechanism, right? First of all, we will focus on surface receptors, right? What are, so for example, I am taking this cell a little big here. I am trying only to clear your concept about the receptor. We will discuss the mechanism in detail after this concepts, right? For example, first we will focus on surface receptor. Surface receptor may be one pass receptor, but this receptor must have two domains. One is ligand binding, second is effector. It may be 4 to 5 pass receptor. It may be 7 pass receptor. The one of the loving one receptor is 7 pass receptor. And next is 12 pass receptor. 12 pass receptor, right? So first of all, we have, for example, one pass receptor. Why it is called one pass receptor? Because this receptor is passing or crossing or penetrating this cell membrane one time, right? These receptors are also known as G protein receptors. G protein coupled receptors are only serpentine or 7 pass receptor, right? So this receptor is called one pass receptors. So the first one is one pass receptor. What is the example of this one pass receptor? Insulin receptors, tyrosine kinase, right? One pass receptors are insulin receptor. But this insulin will attach on one receptor, and it will bring the other one pass receptor to join with the first receptor and will phosphorylate the other side, right? This is one pass receptor. right? We will discuss the mechanism in detail. First, we will try to know about the types. The second is 4 to 5 pass receptor. 4 to 5 pass receptor. What is the example of this receptor? Anyone? Channels, ligand binded ions channels, ligand binded ion channel. We have two types of channels. For example, this is a cell, and I have already discussed this in your physiology, that we have two types of channels on this cell membrane. One is voltage gated ions channels, voltage gated ions channels, right? And one is ligand binding or binded ions channel. So the 4 to 5 pass receptor is these channels, ligand binding ions channel, because the ligand binding ion channel is composed of 5 units: the alpha 1, alpha 2, beta 1, beta 2, and gamma, right? For example, here we have, this is a ligand binding ion channel. This is the first unit. For example, this is the second unit, and this is the third unit, this is fourth unit, and this is fifth unit, right? So they crossing the membrane 4 to 5 times. It may be a 4 chains or 5. These are basically peptides, peptide chains, right? Alpha 1, alpha 2, beta 1, beta 2, and gamma. And they are also called alpha 2, beta 2, gamma receptors. So these are the 4 to 5 pass receptor. Example is ligand binded ions channels, and you are very aware about the acetylcholine receptor, nicotinic receptor. We have detailed discussion on neuromuscular junction, and these are basically nicotinic receptors, and have a site for ligand binding, and it is opening by binding to this acetylcholine. For example, nicotine, when nicotine is binds here, for example, this is a neuron, and it releasing acetylcholine, and when acetylcholine is binds here, this channel opens and sodium influx occur to cell, right? So these are 4 to 5 pass receptor, and these are surface receptors. Why these receptors are present on surface? Because some of the drugs or some of the hormones or some of the neurotransmitters cannot cross across cell membrane, and it is needed to show the responses inside the cell, right? Because these receptors are just like a bell on your gate, a person who is belling is like a drug or ligand, right? The bell is acting like a receptor, and the person inside the home is acting like biological response, right? So this is 4 to 5 pass receptor. The next one of the very famous and very loving and very important receptor, which is called 7 pass receptor. 1, 2, 3, 4, 5, 6, 7. 7 pass receptor, and this 7 pass receptors is also known as, serpentine receptor, because this is the receptor which discovered initially, right? And about 40 to 50% of the drugs respond to 7 pass receptor, and they are basically muscarinic receptor, beta adrenergic receptor, present on heart, beta adrenergic, which acts by epinephrine and norepinephrine, right? Muscarinic receptor have how many types? 5. M1 receptor, M2 receptor, M3 receptor, M4, and M5, right? And basically this receptor have triameric G proteins. What is G protein? The protein which have attached guanosine dia or triphosphate. For example, this it have three units: alpha, beta, gamma, but this have attached with the GDP. So because of this guanosine, these proteins are called G proteins, and they are coupling a lot of proteins, a lot of peptides joining to each other. So they are called G protein coupled receptor. Why? Because these receptors will show the response by activating these G proteins. So basically the G protein coupled receptors are 7-pass receptors. They are 7-pass receptors. Your book mentioned G protein coupled receptor, and they are only talking about 7-pass or serpentine receptor, or it is also known as ligand operating 7-pass receptors. So basically these 7-pass receptors are called G protein coupled receptor because they have G protein. What is G protein? For example, how it will show the response. For example, if epinephrine occur and attached to, this is a ligand and attached to this 7-pass receptor, it will express these protein by breaking down the ATP into ADP, and it will take one inorganic phosphate and it will break down this combination. For example, the beta and gamma will separated from alpha, and this alpha GDP will convert into GTP, and now this is in activated form, right? So this is basically G protein coupled receptor, and about 40 to 50% of drugs acting on 7-pass receptor, right? After we have, what are the examples? Muscarinic receptors, beta adrenergic receptors, right? What are the other type? What is the other type? The 12-pass receptor. For example, it have a ligand binding domain 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. 8 passing the membrane, 12 for 13 times, or 11 to 12 times. What is the example of this receptor? This is called 12-pass receptor. Where they are present? Anyone? Mehran, Saima. These receptors are present on heart, also present on lungs and other body, a lot of location. Where the 12-pass receptors are present? Renal, liver, anyone else? For example, in synapses we have two types of neurons. One is postsynaptic and one is presynaptic. For example, this is the presynaptic neuron and this is the postsynaptic neuron. And for example, it releases neurotransmitters like serotonin or dopamine. These are dopamine or serotonin, right? Of course, the receptors for these serotonin or dopamine will present on the postsynaptic neuron, and it is releasing from presynaptic neuron. These serotonins or neurotransmitters are very important, so they are not lost by body, and the extra serotonin or neurotransmitters will reuptake by this presynaptic neuron, right? So the receptors which are responsible for reuptaking the neurotransmitters from synapse are 12-pass receptors. These are 12-pass receptors, reuptake receptors. And you will discuss an antidepressant drug, the reuptake inhibitor, serotonin SNRIs. serotonin, norepinephrine reuptake inhibitors. The drugs will act on these 12-pass receptors and will block this receptor for reuptaking these serotonin from synapses. Right? So 1-pass receptors are present in pancreas and blood vessels are in liver, which are responsible for showing the response against insulin. They are insulin receptors, but it shows responses by combining the two 1-pass receptors. Right? We will discuss this in mechanism. The 4 to 5-pass receptors are अच्छा क्लास છે તો બધા પૂરો કોમ હા ટ્રસ્ટો રેડિયોલોજી વાળે સસો ક્લાસ નહીં હા. The 4 to 5-pass receptors, the example of 4 to 5-pass receptors are nicotinic receptors, very simple, which are present in neuromuscular junction. The example of 7-pass receptors are many. Beta adrenergic receptors, simply beta receptors are muscarinic receptors. M1, M2, M3, M4, we will discuss this. Right? The example of 12-pass receptor is reuptake receptors, reuptake channels. It will show some conformational changes. In your book, this receptor is called enzyme link receptor. This receptor is called enzyme linked receptors. Right? Don't be confused in book. This is called enzyme linked receptor. It will call the ion channels, ligand binded ion channels. Right? It will cause the G protein coupled receptors, and one which is present in cytoplasm are called intracellular receptor. So now we will discuss intracellular receptors. Example, for example, this is the cytoplasm, and this B is showing the intracytosolic or intracytoplasmic or cytoplasmic or intracellular receptor. For example, the receptors which are present for the drugs which are lipid soluble, which can cross the cell membrane easily. Right? For example, the chemical in your own body, estrogen. What is estrogen? It is a hormone. Estrogen, right? It will came here and will act on this receptor. Right? And with this receptor, it will goes into the nucleus and will show some responses. Right? For example, thyroid hormones, tyrosine T3, tyrosine T4, right? Testosterone, anything which is lipid soluble. The receptors for this tyrosine is present in nucleus. Right? So for example, it goes into cytoplasm and easily it can cross the cell nuclear membrane and will attack on this receptor, which is called a transcription factor. It is mostly called transcription factor. And what is the function of transcription factor? It will initiate protein synthesis. So for example, here we have DNA, and when this hormone or this tyrosine drug, anything else, it occurs in attached to this receptor will expose some area of the special area of DNA and will form messenger RNA and will enhance the protein synthesis. Right? For example, here estrogen also acts on DNA and will enhance some protein synthesis or anything else. Right? These estrogens are present in cytoplasm, estrogen receptors, and tyrosine or testosterone receptors are present in nucleus. Right? The basic effect of estrogen is on breast. It acts on breast, and this tyrosine receptor or tyrosine hormones have a role in growth, cell growth, metabolism, because thyroid glands have a lot of roles or importance in growth, right, or in metabolism. When your TFTs are disturbed, TFTs, thyroid functional test, it is disturbed, that means your body metabolism is disturbing. Right? So now we will one other, the extracellular receptor. Extracellular receptor, for example, I have a blood vessel. Here I have a blood vessel. If in viva or in exam, examiner say that or question, can the plasma protein act as a receptor? Plasma proteins, the globulins, the albumins, etc. They cannot, because they have no effector site. They only bind the drug and other nutrients, and to increase the action time or half-life of the drug or anything else, it holds the drug or nutrients with itself, right? And for example, here in drug we also have some thrombin factors, antithrombin factors, which prevent the clotting of blood. For example, these are blood cells, RBCs, right? These are white blood cells, white blood cells. These are platelets, right? And some, for example, this is antithrombin factors are proteins, right? And for example, you are taking a drug which preventing the blood clotting, for example warfarin, heparin, right? For example, this is the anticoagulant agent, mean drug. You absorb this drug into your blood, it will attach to this antithrombin factor and will enhance the activity of antithrombin factor, and the blood clotting is preventing. So this thing is present in extracellular fluids, because these are the cells and the receptors present outside the cell. So these are called the extracellular receptors. A lot of drugs, basically anticoagulant factors, acting on extracellular receptors, right? And one thing other here, if you are taking some coagulating factors, coagulating like vitamin K activates the coagulations of blood clotting. So, the vitamin K will inhibit this receptor or this factor, right? So they are also acting on extracellular receptor. But here the DNA and RNA also act as receptor, and by this concept we cannot say that all the receptors are proteins, because for example, if we are taking a drug, anti-cancer drug like ductinomycin, for example, this is a nucleus in cell, and this is the DNA. What is cancer? Uncontrollable cell division or proliferation or mitosis. So our aim is to stop the mitosis and by anti-cancer drugs, and one drug is called ductinomycin. Ductinomycin is anti-cancer drug. For example, this is the DNA have two types of grooves. One is major groove, one is minor groove. This ductinomycin, for example, this is duct, so it is duct like. I don't know how the duct look like, right? So this is ductinomycin. This ductinomycin hold this minor groove and stop the DNA replication. DNA replication occurs in which phase of interphase? G1, S or G2? S phase. And S phase DNA replication occurs before the cell division, right? So it stuck the DNA replication in S phase and the mitosis is prohibited in S phase. So it causes the inhibition of mitosis. So this is dactinomycin is anti-cancer drug and it acts directly on DNA. So DNA also acts as a receptor, right? The cytosolic drugs are, for example, we have 50S ribosome inhibitors, which are called macrolides. Macrolides, azithromycin, clarithromycin, erythromycin, antibiotics. For example, this is a ribosome in cytoplasm. This is 30S unit, 30S unit. This is 50S unit. When you are taking erythro or macrolides, mainly macrolides, the macrolides cross this membrane and attack on this larger unit of ribosome. This is so the ribosome also acts as a receptor because the drugs are acting on what is the biological response of this ribosome. It will stop the biological protein synthesis, right? So it also acts as a receptor. So receptors have how many types? 4 types: surface receptor, intracellular receptor, intranuclear receptor, and extracellular receptor. The surface receptors are, they may be 1-pass receptor like insulin receptor. They may be 4 to 5-pass receptor. They are called ligand binded ion channels. The example is nicotinic receptors present in neuromuscular junction. A lot of diseases are also related to this ligand binded ion channels, nicotinic receptor. Myasthenia gravis is one of the best example of diseases of neuromuscular junction, right? The next, surface receptor may be 7-pass receptor, and this is the most common receptor, right? Most of the drugs act on this 7-pass receptor, and they are also known as G protein coupled receptors. These receptors are also known as enzymes linked receptor. They are also known as ligand binded ions channels. These are called G protein coupled receptors, 7-pass receptor, and this is called 12-pass receptor, or this is the example of 12-pass receptor is reuptake monoamines, right? In antidepressants, one class is monoamine oxidase inhibitors, MAOIs, right? So they will inhibit these receptor, 12-pass receptor, right? The intracellular receptor, the receptor for cholesterol, a receptor for steroid hormones, estrogen, progesterone, etc., present in nucleus, right? And some of the receptors for cholesterol or fatty acid substance, lipophilic substances are present in cytosol, and this ribosome is also present in cytoplasm and it acts like a receptor. This DNA is present in nucleus and it also acts as a receptor, right? So these are the types of receptor. Now we will discuss the main mechanism behind this activation and inhibition, because the receptor may be activated, it may be inactivated. There are 2 conditions or 2 states of receptor. When the ligand is binded to a drug, it forms ligand receptor complex, right? So in pharmacology, the ligand is a drug. When the drug is bind to a receptor, it will cause drug receptor complex. Like when the substrate is binds to an enzyme, it is called substrate enzyme complex, right?